I'm South Carolina State Representative Leon Howard. I'm the chairman of the Richland County Legislative Delegation. I also served as chairman of the Medical Affairs Committee for 15 years, where I established a great relationship with so many healthcare providers. They had a workshop at Columbia College, and it was more focused on men. And Anthony Jackson, he shared a lot about healthcare and his personal battles with health issues. And in that workshop, retired physician, 2 dynamic physicians, and a couple of other healthcare professionals was there to have a conversation with men about our health. First, they encouraged men to have regular checkups, prostate exams, colon, heart disease. And one of them talked about how heart attacks can present themselves in a different manner. And so maybe a day or 2 later, I woke up with excruciating shoulder pain. I dismiss it because I'm in the automotive business. I had done some work on a vehicle, and I dismiss it as a pulled muscle. 2 o'clock in the morning, it continued to be excruciating. So I decided to call 911 just in case. Paramedics came to my residence, picked me up. I did not expect the paramedic, the young lady, to tell me that I had had a heart attack or was having a heart attack.
In the ambulance, his EKG, which is tracing of his heart, showed that he is experiencing an acute myocardial infarction. When that happens, the EMS will trigger something called an activation, basically, for the on-call interventional team to come into the hospital so we can intervene on the patient right away so we can minimize the damage to the heart muscle. In these procedures, they're minimally invasive. In his situation, we end up going through his right wrist, and through that, thread a wire and then a catheter that will go all the way from the right wrist to where his ascending aorta is, and go ahead and engage the blood vessels that come off his heart and visualize them with contrast and using fluoroscopy. And so from our angiography, it showed that he had 100% blockage to the right coronary artery, and we proceeded with an intervention at that point, putting a wire through that blockage and using a balloon to open up the blockage, and then following by placing a stent. And that restored normal blood flow to the heart muscle, and it helped in resolving the symptoms that he was experiencing, as well as his EKG changes.
Stayed in the ICU a few days, but as far as the staff and the professionalism, how I was treated there, it was superb.
We're fortunate that the people that we work with all collaborate, and it feels like almost like a family atmosphere. I mean, it's not just me who's performing this procedure. We have nurses, we have radiation techs, we have our team in the emergency room, and everyone is on board when someone is coming with such an acute emergent case that need to be taken care of right away. And so all hands on board, everyone is there, everyone is working very fast to try to make sure that the patients receive the best care in a timely fashion. And by the time they're ready for discharge, they have the appropriate educations and refills and all of the material that would set them up for success.
I don't smoke. I'm not a drinker. I'm a low-stress person. Stress is something that I inherited that from my father. It just doesn't bother me. And my physicians think what created the heart attack was cholesterol. I'm not paying attention to cholesterol. But I have changed eating habits where, probably, bake, grill, vegetables, a little more exercise than I used to. And here at the State House, I usually don't take the elevator. I take the stairways. And my office is on the 5th floor. So I run to my office, back and forth to the office, from the State House to the office, and I usually try to avoid the elevator. My goal as a member of the Ways and Means Committee is obviously try to put more funds into healthcare, into prevention, and try to encourage the 124 members of the South Carolina General Assembly to hold workshops in their community, talking about health care, talking about what to look out for, encouraging people to pay attention to their health, particularly men. I feel like the workshop I went to literally saved my life.